Peyronie's disease has got a devastating effect when it comes to the morale of men. Peyronie's disease, a disease of painful organ, palpable plaques or buttons or nodules that men sometimes feel, and a curvature which actually makes the bend of an organ make it a Peyronie's disease, a disease which is a disease of agony, a disease of disgust, a disease of progression. So palpable plaques, painful erections, and a kind of a curvature in the shaft of penis is sadly the story of Peyronie's disease in young men across the country and the world. Mature men in the late 30s, 40s to 50s, 60s, and 70s. When we see younger men in the 20s, teens, and we see a curvature or a bend in the long organs that they have developed as a result of the hormone changes, it's congenital curvature of penis, not necessarily Peyronie's. It's not an acquired disease. Peyronie's disease, unfortunately, is an acquired phenomena, a phenomena where the tunica albuginea develops that kind of idiopathic fibrosis or a kind of fibrosis or a hardness which is progressive. It's not an injury related fibrosis which forms a plaque, but it's a progression which happens idiopathically because of immunoreactive changes, because of microtrauma, not contributed but causally also related partly to diabetes, as I see more and more diabetic young men coming with this. So progressive change, which brings about the morale down so much in terms of complaints of shrinkage of the shaft of the penis, in terms of erectile dysfunction, a more larger picture that they come with, in terms of a painful penis or a pain in the penis, which is difficult to decipher and treat. And the agony is for the last few months, it's already progressive. I'm afraid of the erections that the men have in that age group. And then the bend, which is progressive, or called the curvature or the chordee. So having a chordee or a bend progressively, which makes you change your positions in the bed, looks at you gradually becoming incapable to performance with a partner as a result of the curvature bending to 30, 45, 60, 90 degrees is something sadly not uncommon. Man, this is something which needs to be thought of, needs to be spread as an awareness because men who suffer from this suffer with real agony. They hardly know where to go to, what to do. They get vitamin E capsules, they get various medications, they go and see their colleagues, their doctors in various fields. And finally, at the end of it, the disease progresses and becomes stable. But not before it has caused a huge amount of, disgust and distrust about this body which has progressed without no fault of his. There's been no trauma, there's been no injury. He may not be a smoker, he may not even be a diabetic. And the progression has happened without much knowledge. And he finds himself completely incapable of performance in the bed as a result of progressive change in the bed. So if that is happening, the treatment is completely available. पुरुष 30 से 50 साल की उम्र में जिनका लिंग धीरे धीरे बदल रहा है और जिनके लिंग में बहुत शॉर्टनेस आ रहा है, जिनके लिंग में वो बेंड या कर्वेचर आ रही है जिसके बाद वो परफॉर्म नहीं कर सकते, जिनके लिंग इरेक्टाइल डिस्फंक्शन का कारण बन रही है और जिनमें एक गांठ फील होता है उनको या उनके डॉक्टरों को, वो दवाइयों से ठीक नहीं हो पाता। उसकी नेचुरल हिस्ट्री भले ही हम स्लो कर सकते हैं, उसके नेचुरल हिस्ट्री को हम जरा आउटपेस कर सकते हैं, दवाइयों से आपकी दर्द और पीड़ा को तो ठीक कर सकते हैं, इरेक्शंस को संभाल सकते हैं, लेकिन एंगुलेशन शायद बंद नहीं हो सकता, ये दिखता है। इसका मतलब बहुत लोग एडजस्ट करते रहते हैं, दवाइयों पे रहते हैं, उनकी एक्यूट फेज, उनकी एक्यूट हिस्ट्री ठीक हो जाती है एंड दे गेट सॉर्टेड आउट इन देयर पेन एंड डिस्कम्फर्ट। इरेक्टाइल डिसफंक्शन गेट्स मैनेज largely, if not completely, by various medications and injectable aspects, even vacuum erection device. But then comes that progression of change, the bend, the curvature, where that doesn't let them stay stable. And that's where, in a mature disease, a disease which has shown bend, it is important to straighten the bend. So, for all men who suffer from a bend or a curvature or a pain in the penis, related also to erectile dysfunction and shrinkage in the prime of their life, they would look at cure. They would not look at cure the disease per se, but the effects of a disease which actually has happened around. And Peyronie's disease effects are devastating in men, in the men of their prime of life. So the Kokilaben Hospital in the Department of Reconstructive Urology, where we look at various reconstructions. We also look at penile processes. We look at corporoplasty. We look at small penis turning into the larger sizes. We're looking at the girth and the length. We're looking at the angles being straightened up and they become a straight penis, capable performers in the bed. We look at the entire aspect of prosthetic urology, where we look at male incontinence, leakage of urine post prostate surgery, be it cancer or be it benign disease. We look at women suffering from incontinence of urine, where a female urethral sling can just make a difference to their lives, a life without diapers. So as I get into the awareness aspect of cure, with me and my colleagues in the country doing this, It is important for us to look at reconstruction with a lot of understanding, a lot of counseling, bringing them that aspect of care that they look forward to, giving them that care and cure that they're searching for, and that's so much of disgust and distrust. The body is changing and not much can be done, and the progression is on, and the progression finally has stabilized and become chronic and made them incapable is all treatable. So friends, Peyronie's disease की ill effects treatable हैं. इरेक्टाइल डिस्फंक्शन, लिंग में पीड़ा होना, लिंग का पूरा बेंड हो जाना और इरेक्शन से न हो पाना, ये धीरे धीरे श्रिंक होते रहना, इन सब चीज़ों की ट्रीटमेंट अवेलेबल है। वंचित ना रहें और इसे न छोड़ दें इस जमाने में, बिकॉज आज जो आप हैं इससे दुरुस्ती हो सकते हैं, कल वो समय ना आएगा जब आप उस उम्र के होंगे जब आप केपेबल नहीं होंगे। तो फ्रेंड्स, इस अवेयरनेस की जरूरत है। ये अवेयरनेस बहुत हद तक मिसिंग है। ट्रीटमेंट हमारे देश में है, कुछ डॉक्टर्स हम लोग ये ट्रीट करते हैं, और बहुत से लोग यहाँ मुंबई कोकिलाबेन धीरूभाई अंबानी अस्पताल आके इसकी ट्रीटमेंट करा के अपने घरों में ठीक रहते हैं। हमारी कोशिश होगी कि आप कैसे ठीक रहें, हमारी कोशिश होगी कि कैसे हम आपको जागरूक रखें, और जितने भी लोग इन सब चीज़ों से सफ़र करते हैं उनकी ट्रीटमेंट की कोशिश हमारे साथ होगी। एवरी लाइफ मैटर्स, और आपकी क्वालिटी ऑफ लाइफ को इंप्रूव करने की कोशिश में आगे इसी तरह बढ़ते रहेंगे। धन्यवाद।